We are back. Hello, broads. How are you? This is your girl, Queen ShanShan. Hey, girl. Hey. And we got a new amazing guest, Dr. Kush Verma. How are you, Dr. Kush?
Thank you so much for having me. This is a lot of fun.
Do you want me to call you Kush or do you want me to call you Verma? You want me to call you Kushagra?
You can call me whatever you want. Most people call me professionally Dr. Verma, and then personally it's Kushagra. It's a little long, but I like it. It's a little bit of an unusual name, but it's grown on me.
Okay. Well, I'm going to be professional and call him Dr. Verma. We're going to get into who Dr. Verma is in just a moment, but I want to say thank you so much for our last episode, episode 64 with Sharon Williams. It was a fantastic episode. You guys blew it off the chain. We had over 18,000 views on YouTube. We had over 20,000 listeners international wide on that last episode. I don't know why that episode just blew up. It was wonderful. Sharon Williams, if you recall, is the co-owner of Nappily Naturals here in Los Angeles, basically Limerick Park, with her husband Umar. And again, we spoke about the holistic way of living. It's a Black-owned apothecary, one of the very few that's here in California, and just what she is going to be doing the next year in terms of growing her business and where she started and how she's maintaining that momentum. So please take a look at it if you can. Again, all of our episodes is on YouTube, A Broadcast Podcast, and then you can listen to all the podcast platforms on your favorite podcast platform. We again have some great news also, is that we have a new newsletter. And Dr. Verma, I would love you to be part of the show that we're going to have. Part of the show that we do is to put you on the newsletter as well and talk about exactly like some pinpoints of the show that we do. So the newsletter, again, of course, focuses on travel, food, beauty, and culture. But what I'm doing with the newsletter, instead of taking all four aspects and putting it on one newsletter, that's a lot. So what I'm going to be doing is we'll take one article, we'll talk about all travel. One article, we'll talk about all food. One article, we'll talk about just beauty. And one article, we'll talk about just culture. So you guys will have a true flow of each month. And so it'll focus on either one of my vendors or obviously my guests that are on the podcast. It's going to have local events that's happening in Los Angeles because I really want to focus on our town. You may not live in LA, but you're going to visit LA. You want to visit LA, and I'll tell you what's going on the next month. And then, of course, we always have a vendor or a highlight spotlight for our vendors. So it's a really new venture that I'm doing. The 4th edition will be out in July. Okay, so let's take a quick break. Speaking of our vendors, let's take a quick break and take a little listen to our vendors, and we'll be right back. Woo! I just came from Nappily Naturals Apothecary, and I got a great haul today.
Girl, tell me what's in that big bag.
Well, I just went on vacation, and unfortunately I got a skin rash. So I bought some extra soaps, some skin oils, and also this wonderful shea butter that helps with the itch.
Well, I know a thing or two about rashes and itches.
Well, we will talk about that later. In the meantime, Nappily Naturals and Apothecary is located centrally in Los Angeles. It is a family-owned brand, and they have everything you need to take care of your health. And get this, they're using Queen ShanShan for 15% off. So if you want to go to Nappily Naturals and Apothecary, you can go into the store and use code Queen ShanShan, or go on their website, NapoliNaturals.com, and order anything you want. And remember, tell them Queen ShanShan sent ya. Hunty!
Hey, Queen ShanShan, how are you?
Hey, Coach HT. I am picking up some groceries for the week, girl. What about you?
Yes, I am with you. I'm just making sure I get my fresh produce. I saw that you just got back from France. How was it?
Mi amor. France was fabulous. The food, the wineries, and of course, lots of shopping. But you know what? After those long flights, I am in so much pain and discomfort. My shoulders, my back, my hips are just so tight, and I'm also going through some major jet lag.
I know how it is. Those international flights are the worst. Everything hurts. But Queen ShanShan, I must tell you, I created an easy on-the-go mobility program for those who like to catch flights, not feelings. I call it the Fit Travel Kit.
100%. How do I get access to those tips right now? Spill the tea.
The tea can be found on my app. Write this down. It's at app.thefitgym, that's PHYT.com.
Au revoir. Oh, Devin,
What's the matter?
I have a toothache and I'm just, I don't like going to the dentist. I'm so scared of dental chairs and dentists and needles, and but I gotta take care of this pain.
No. Say no more. I know the perfect place for you. It's called Exquisite Dentistry. Dr. Agil is his name. And they actually specialize in dental chickens, meaning like people that are scared to go to the dentist because they're so gentle. And they will calm your nerves, girl.
I'm just really scared about dentists. What other services do they offer?
This place offers a spa-like experience from the second that you walk in.
Well, I see on their website they offer soft lighting, warm blankets, noise-canceling headphones, and aromatherapy. Wow, I need to make an appointment today.
Absolutely. It's basically first class.
Well, I'm going to give them a call today and look at their website at exquisitedentistryla.com.
And don't forget to mention Queen ShanShan sent you.
Hunty. Thank you, Nappily Naturals. Thank you, Fit Gym. And thank you also to Exquisite Dentistry as our amazing sponsors. We really appreciate it. So once again, we have Dr. Verma here. Dr. Verma is actually my new doctor. I just literally met him a week and a half ago, and we hit it off that quickly. And how I met Dr. Verma is that my Aunt Peggy is his patient. And so when my Aunt Peggy was going through some back issues, she said, you need to talk to Dr. Verma. I was like, okay, tell me about him, because you've done amazing with her. She had an extensive surgery last year. He performed the procedures, and she's walking better. She feels better. I just spoke to her 2 nights ago, and she's so excited that I'm meeting you and that you're on the show. So she can't wait to listen to the podcast.
She's a great patient. I loved her. And, she had 3 bad levels, which is a little unusual. When you have multiple levels, sometimes that means you have to do a bigger surgery. But we were able to do kind of an all minimally invasive approach, like 3 little incisions, basically, to kind of fix multiple things in her spine. And she did great. It ended up being broken up into 2 days, but we didn't do big incisions for her. So she had a still relatively easy recovery. And she, I think within a couple of weeks, she bounced back, and she was, I think, better than before surgery.
Was it all arthroscopically?
It's not arthroscopic really in spine. It's tubular. So like the lateral procedure, we do it through a tube, where I look through a tube.
Wow.
And then the anterior, the front surgery, we do it through a couple of very small retractors and a small incision. And then for the back, we'll often put the screws in through small incisions. And they're put in usually with the assistance of like a computer system, where it tells us the screws are going in the right place. But no, it's different than like, the abdomen, where you might fill it up with air and do surgery like that.
That's okay. So as a civilian, we always think that back surgery means that we got to be on our stomach for all back surgeons or to do the surgery. You go through the stomach at times, which is so unusual to visualize that you're going through my stomach to fix my back. So, I mean, that means you got to move the intestines, you got to move the pancreas, the liver, all these other organs.
Yeah.
And that could be really painful in terms of recovery, right?
Well, actually, it's the opposite. I mean, if you want to go down the rabbit hole with spine surgery with me, we used to always do a lot of anterior surgery. If you look at spine surgery 20, 30 years ago, there was a lot of anterior surgery, where basically we make an incision in the front of the abdomen here, and then maybe clean out these discs and replace it. But we kind of moved away from it because the incisions were big. The surgeries were kind of morbid. You had to do front surgery with big incision. Then you had to do back surgery with big incision.
Right.
And so there was a big movement away from it, to really do all posterior based surgery. But then you have a big incision on the back. And there were some issues with all posterior surgery, I think. Mainly we didn't add enough curve to people's spines. The bones wouldn't always fuse together. We'd have a higher revision rate. We'd have, issues where even after we fix the spine, the adjacent level would fail. And what I mean by adjacent level is we'll fix 3 levels maybe on somebody, and then within a short period of time, the next level will fail.
Oh.
So that gets frustrating for the patient and the surgeon. And so over the last 10 to 20 years, there's been innovation in the anterior and lateral space. And I think we're very fortunate in Southern California because pretty much the main company that drove minimally invasive lateral surgery was based out of San Diego.
Really?
And they did a lot of teaching for surgeons, and that sort of led to the technique being adopted really a little more in Southern California. And then when it comes to anterior surgery, we usually do that with the assistance of a vascular surgeon. Basically, we have to put a retractor around the artery and the vein just for safety. We always get a vascular surgeon in there. We do the case together. But what's really unique about Southern California is we have these amazing vascular surgeons. We have a few guys that will literally do it through tiny incisions. We can do it all minimally invasive. And we can even take that surgery that previously was kind of big and morbid and now do it at a surgery center. And so,
instead of a hospital?
Instead of a hospital.
You're telling me you can now do all these procedures in an outpatient procedure?
Absolutely.
What? Without spending the night?
Sometimes people spend the night, but it's still considered outpatient. They just leave at like 6 in the morning. And they get a nurse kind of taking care of them overnight.
Okay.
Because, that first night, there could be some
rough.
pain and things like that. It's not a bad deal. But that's kind of the direction spine surgery is going, is that we're doing more and more outpatient surgery. It's what I think is exciting about at least regular, when I say regular spine surgery, it's like bread and butter pathology, the stuff most people have. 1 bad level, 2 bad levels. We can now almost always address those kinds of issues, either with a laminectomy, which is basically like a shaving procedure. Basically, we use a drill and we shave a little bone off the nerve. Or we can do like a fusion or a disc replacement. And again, that's done through small incisions and we can do it outpatient. So, I mean, that's a major change compared to where we were, when I was a med student.
We jumped into this conversation real quick because I have quite a few questions. We want to talk about my actual diagnosis because I'm having sciatica issues and back issues for a long time. And I'm having knee issues and I possibly may be having a knee replacement surgery. I'm not looking forward to this stuff, but the body's breaking down. And so we need to fix it. And I'm sick of having, this will be I've had 3 MCL surgeries. I'm just over it. So we'll get into that in a minute. We got into this conversation real quick. Where are you from?
Okay.
Where did you study?
Yes.
How did you get into be a spine, am I saying it? Cirrhosis? No. What's the word?
Scoliosis.
Scoliosis.
No, it doesn't roll off the tongue.
No, it doesn't. Specialist. So I want to talk about your education, where you're from, what is your motivation, and how are you here?
I love it. So my parents are immigrants. They came here in the late 70s, and my mom came here in 1980, and I was born in 1981. Okay. They came from India. My dad was a Fulbright scholar, very intelligent guy. But my parents struggled those first 10 years. My dad was a PhD student. My mom's a musician. And I think there's value when you see your parents work hard.
Yes.
Even if you're a kid, you sort of get it.
Absolutely.
The way ahead is to work hard. So I think I always had that in me. I'm not somebody that could do a desk job, though I think I was always smart. So I was sort of drawn to engineering. And a funny story is that as a freshman in high school, I did a little engineering project and I won the whole state science fair. And it was a little unheard of to do that as a freshman. And it was all presentation and flair. I don't know if there was any substance to what I was doing, but I definitely.
What was that your project?
It was silly. I made a little windmill out of a giant box fan, and I got a Tinker Toy set, and I would make little wings on the Tinker Toys, and then basically showed which wing designs made the windmill go faster.
Okay, so it was just it was something that was a visual.
Yeah, it was visual. I had a nice presentation. It was a good presenter.
But you won it. Was this high school or college?
It was freshman year of high school, and then I did it again my senior year.
Okay.
And so even though my grades were probably not super, super stellar, I sort of had an eye for engineering and research. So I got into a good college. I went to Cornell.
Nice.
And yeah, that was hard, actually. I tell people that was harder than med school.
Wow.
So we're all the way up in the corner of the country, snowed all the time.
Right.
And then just the culture there is you get up, go to the library, and you study. Every Saturday, every Sunday.
Yeah. No social life.
I mean, there was a little bit, but it was pretty intense. And I remember I got out of college and I was like, I'm not going to med school. That was too much. And so I had a year off, and I thought about doing engineering. I even worked for a cool company where we like designed the total artificial heart.
Wow.
It's a company called Abiomed. I probably should have bought stock back then, but they ended up doing pretty well. But I would spend every evening watching surgery videos in their library when I was doing my internship there in college. And I was like, man, there's something about this that's really pulling me in. So I got interested in medical school and surgery. And I ended up going to NYU because I was doing research there. And
You went to all the great schools here.
I got lucky, I think. I did research with a guy at Cornell. His name was Peter Nathaniels. And at that time, I was really gung-ho about high-risk pregnancy. I was doing research with him. I thought I wanted to do obstetrics or neonatology. Then he moved his lab to New York, NYU. And so I moved there too. I was like, I'm going to keep doing this research. And the minute I moved there, he's like, actually, I'm moving my lab to Texas. I'm like, I'm not going to Texas. That's it. I'm stuck here. And then I ended up getting a master's degree, and I ended up going to med school at NYU. And then in med school, the first 2 years are a little rough. It's a lot of studying. But around my third year, I realized I probably wasn't going to do obstetrics or neonatology. And I walked into the operating room, and I saw a pediatric surgeon putting screws in a kid's spine, and I was just for scoliosis.
Yeah.
And I immediately was like, this is what I want to do.
Really?
This is the coolest surgery I've ever seen. And, they pull the spine straight, and it was David Feldman, Baron Launer, Tom Errico. These are the guys at NYU. And I was lucky because I just showed them a little bit of interest, and they like pulled me under their wing, and they're
That's
like, oh,
good.
let's get you involved in research. I ended up taking a year off, and I got really into it, and I wrote like 20 or 25 papers that year, which is a big deal to do that as a med student, write a lot of research papers, and it helped me get into residency, which is like the next step where you learn how to operate on people, orthopedics, knee replacements, hip replacements. And I went to a program, Jefferson, which is heavy spine volume, and some good mentors there. I got a lot of good pediatric exposure. And then my fellowship, which is an additional year of training, was in San Francisco. And that was all in complex spine, scoliosis, big cases. And I also had the kind of cool experience in med school where I was doing all this research, and I met a surgeon who did charity work in Africa. His name was Professor Boachi. And he was at a hospital for special surgery in New York. And I heard him give this talk about spine surgery in Ghana on kids. And I was just like, again, this is the coolest thing. I ran right up to him in Vienna. I remember I was giving a talk, and he gave a talk. I was like, please, sir, take me with you. And he was great. He's like, sure. And so I went to Ghana in 2009 as a med student, and it just solidified this to me. I'm like, I had a very clear vision. These are the types of things I want to be doing with my career. I want to be this kind of surgeon. And I think it's great if you can get that when you're young, because it kind of fuels you through some of the hard parts of the training. It's not all roses. And
Yeah, it's not.
It's a lot of getting up at 4 or 5 in the morning, a lot of putting yourself last in terms of the priority list. And I think it was great. And I always hung on to that like experience. And then through residency, fellowship, I have kept doing charity work. And it's still like a big part of my career. I am going in September this year back to Ghana.
Yes, I want to talk about that.
We'll talk about it.
I want to circle that because I think that's a fantastic.
Yeah, and I would,
opportunity.
Part of my goal career-wise is to get people to be interested in it, get surgeons to go and fundraise, because it's done so much for me personally, I think.
Yeah.
And it does, I think, a lot. The experience is very special, specifically for a surgeon.
Right.
Anyway, so after fellowship, in San Francisco, my wife and I loved California. A little hard to get the ball rolling in Northern California for a new surgeon. I ended up in Seattle for 2 years as a professor, doing a lot of complex spine. And then after that, I moved to Los Angeles. Once I figured out a little spot for myself in LA. I think LA is a great city. Huge, tons of opportunity. You have LA, you have Long Beach, you have Orange County. You will always find work. And also when it comes to the type of training I had, it was more complex training at first. And there was relatively few surgeons down here that did that kind of work. So I was like, I'll be able to get started. I'll be able to build a practice. And then over the last 7 years, I've made a lot of friends in LA, and they've been pioneers in disc replacement and minimally invasive surgery. And now I'm really into that side of it too. And so I think spine surgery is really evolving in two directions. The simple stuff, which we call simple surgery, is really become outpatient and minimally invasive with easy recoveries for patients. And the more complex stuff, I think we're managing it better than ever. And so we take care of both issues now for patients, and so pretty much anyone can come see me, a kid or an adult, with either a simple problem or a complex problem, and we should be able to help them.
What was your, thank you for sharing that. I appreciate that. Thank you. Um, with you going through all this training and meeting people, and instead of you working at a big hospital, because that's where most of the residents start. You guys start working in hospitals for your
Yeah.
training and everything. What was the final decision? Said, I want to have my own practice, because it's not just opening a practice. This is a business decision. And, that means money out of your pocket. You have to hire staff. You might have to get a brick and mortar, or, share different office spaces with other doctors. What was that what was the decision that made you said, let's just do it, babe? Or honey, wife, let's do
She
this
was
and make
not
this
on board at
She
first.
wasn't.
No, it's
She
terrifying.
wanted you to work at the hospital and just earn a
Well,
regular paycheck and do that in and out 9 to 5.
I mean, I think, she probably wanted stability, but I think surgeons are risk takers by
Okay.
nature. You have to have a certain personality to do this job, for sure. And I did that. I did the university job in Seattle. And one of the problems is that you're sort of on this academic path,
Yeah.
which may or may not be a great path. If you're in a good place, it might work out great. If you're in a so-so hospital in a state you don't want to live in, it maybe not the best path. What are you going to do? Give up 10, 15 years of your life
Mm-hmm.
living somewhere you don't want to live, to pursue this academic career at a big hospital. So I kind of let that go.
Okay.
I joined a group, and a group in private practice is great to start out because you get a lot of volume thrown at you. A lot of people will refer you patients, even
Right.
if you're nobody really knows who you
Mhm.
are. And all the logistics of running a practice, you don't really have to deal with. But then the downside a little bit is that the whole practice is not focused on your specialty or you. So the customer service side of it, your ability to have autonomy, do what you really want to do, isn't really there. I remember when I was with a group, one of my partners is like, well, why are you going to Africa? I'm like, what are you saying? Like, how dare you? How dare you tell me not to go do outreach work,
Right.
And then, they were asking me to do hip fractures and all this stuff that I don't really want to do
You didn't
anymore.
want to do that. That wasn't enough.
No, I've kind of let that. I do sort of think if you're going to be a high-level spine surgeon, you got to just do spine.
Okay.
Like all of my energy is
That
spent
makes sense.
running the practice, talking to people, and doing surgery.
Mm-hmm.
And then what's left, I try to be a parent and stay in shape,
Oh, yeah. Absolutely.
And if you're trying to do hip fractures and knees and this and that, it might be okay in the beginning, but ultimately it'll keep you from growing as a surgeon.
If you focus on one particular practice, then you're going to make that practice. I mean, that's why it's called practice. You guys are practicing medicine, or if you're an attorney, you're practicing law. You're never going to be perfect at it because you have to keep learning. There's different ways to do things. And as you just said, 20 years ago, the technology has changed, which happens all the time. So having this particular skill set, you want to make it better every day. So you have to keep learning.
Yeah.
And if you're trying to learn 4 or 5 different specialties, it's hard to focus on one thing.
Yeah, absolutely. And you never want to take care of somebody's hip fracture. You're not really a great hip surgeon, and then doesn't go that well. And they'll be like, well, I'm never trusting that guy with my spine.
Exactly.
So I just think it's just better for spine surgeons. It's a complex enough specialty, and people need your time. It's not like getting your knee scoped. People want to get to know you. We spend a lot of time with people before surgery. And so when I decided to go off on my own, the goal was really to be we want to be the absolute best in customer service. And the minute people call to their consultation, whether they're surgical or not, we want them to have a great experience. Wow, this is the best.
Let me tell you something. When I called his office 2 weeks ago to make the appointment, again, I was referred to from my Aunt Peggy. You had a person that answered the phone. I don't know what his name is. So nice. And then she's like, okay, now I'm going to because he did my name, date of birth, and that I did do, checking my insurance. And then he transferred me to another girl. Don't know who she is. And she's the one who set me up with the appointment. Again, very professional. And the thing is, what's funny, this is even though you just said there's a lot of specialists here in LA, but you guys know each other. So I did not know that his office was in the same office as my other knee doctors, Bulchinski and Dr. Leah Riswilla, which I'm seeing Monday.
She's great.
She's awesome. She's so sweet. They're in the same freaking building, same
Well,
office. I was like, what? How lucky am I to get my spine surgery person and then my knee surgery person in the same office?
yeah, so it's a little bit interesting. There's some groups that are sort of developing in LA, basically to try to pull surgeons together, try to drive surgery in the outpatient setting, which is great, and maybe help us negotiate and get fair payment from insurance companies. This is all great. But I kind of value being independent as well. So what's really nice is I'm affiliated with the DISC group.
Yes.
Um,
Yes.
and that allows me to sort of be part of their group, but I'm also completely independent. So I have my entire entity, Advanced Spine Care, is our practice. We run our own staff. We do everything independent, but we're able to see patients at their facility. We do surgeries at their center. We collaborate with the doctors. And I like that. My number one goal as a surgeon really is to be an educator, and that's for the patients, and also for my friends and colleagues. Right. Every spine surgeon has slightly different training, and they have maybe some skills that are a little bit better in some area than the other. And it's very rewarding as a surgeon to be friends with other spine surgeons. You're always learning from each other, and especially a specialty like spine, where I do think it's changing very quickly. You got to be on top of everything.
You got to be on top of it.
And before things even get published and we're able to study it, I'm able to talk to my friends about, hey, well, what are you doing for this? Are you doing more disc replacement? Which disc replacements are you doing? How are your outcomes doing this? What's your technique with this? I think that's the great thing about being a surgeon. And the vast majority of good spine surgeons are collaborative, which I think is great. Mm-hmm. And we have a lot of great surgeons in LA and Orange County, and I'm fortunate that over the last 7 years, I've gotten to know a lot of them.
Now, how many offices do you work out of?
So we have 2. Our main office is in Los Alamitos, which is right next to Long Beach. That's where I got my start. And I kind of chose to start down there because Miller Children's Hospital is there, and I always had a soft spot for kids.
Miller's Children?
Yeah. Okay. So if I ever have a pediatric case, I can easily do it there.
Okay.
But then gradually over the last few years, we've been expanding to Marina Del Rey. So we can have an LA-based practice as well as an Orange County, Long Beach practice. And so that's where the kind of collaboration with DISC comes in. Mm-hmm. And they've been a great group, and they're expanding. And what I really like about them is they have a lot of young surgeons involved with them too. Okay. And I also go to another surgery center in Marina Del Rey, and they're forming a group, the Commons Group, also a great group of guys. So I think, I'm very fortunate that I've met and made friends with some great people.
What is the motivation that you have to continue growing into this field? Because I'm in insurance. It's insurance is boring, but it also is unpredictable. My business, my industry changes every day, with the laws, with litigation, with legislation, all these kind of things. The demographics are changing because everything's based on age. The liabilities change, so I have to continually learn new procedures and new things to keep my business rolling. What are the challenges that you have in this industry that continues to maybe be a pro and a con to you?
Probably the biggest challenge is managing patients' insurance. I mean, it's quite a challenge to get surgery authorized. Then even once we get it authorized, we're not often paid, and or underpaid. I remember in 2023, I did an audit. I'm like, well, that's what happened. And out of 220 surgeries that I did, 80 were unpaid or underpaid. And so it was really like an eye-opening experience that, even when we're contracted, we're not collecting everything we should be collecting. So that's been a big struggle. And then, they're always making cuts to Medicare, of course. And so a lot of the Medicare cases we do are essentially like our charity, like we're just going to do it to help patients.
That like pro bono type of situation?
There's some revenue that comes from Medicare, but it usually isn't enough to be profitable.
I don't want to get political. We're not going to get political on the show, but things are possibly changing because of this administration. And as you read in the headlines that Medicare and Medicaid may be reduced, we don't know how soon, but it is on the table, the big, beautiful bill. If that happens, doctor, what, in your opinion, could, that's 90 million people 90 million people will be affected, and most of them elderly and most of them disabled. What is that going to do for you? How's it going to affect your field?
Well, I used to have a practice that was a little bit more Medicare, and I'm just full disclosure, not a political person. I made a decision in 2020 during the pandemic. I watched too much CNN and I watched the insurrection that I just said, you know what? This is not in the circle of my control. This is not something I can control. And the world's a little crazy right now. And so I've chosen to focus on the things I can control.
It was crazy 4 years ago. Now it's even crazier now. It continues getting crazier every day.
Yeah, a good friend of mine once said, well, if you watch too much TV, it's like drinking a cup of poison every day. And my sister works for the government, and she's, all tangled up with all these government cuts and things like that. And I told her, well, it may not be under your control. What can you control? Maybe there's something you can control that isn't politics, and if you focus on that, it'll probably make you happier. And so that's sort of my opinion on it, because there's no way I can keep up with all the information, and you get into a lot of these heated arguments that I'm not sure who's right half the time. Am I right? Am I wrong? Are they right? Are they wrong? These issues are all very complex. But when it comes to Medicare and Medicaid, we do know that Medicare is going bankrupt. And we don't, I don't think anyone has a good solution. I think it's a really valuable program, and it's, how we're able to help a lot of underinsured people and above 65. And I still have a lot of patients that are Medicare that I take care of. But what I try to do is be a little bit balanced as a business, so I'm not doing so much of that volume that we're in trouble financially.
Right.
And that's some of the stuff I've learned the last few years, is to try to make sure I'm balanced, as a practice.
But if this does happen, it may not happen tomorrow, and it may not happen next week, but with the legislation, it could take a few years to get the ball rolling. But when that first bullet is fired, that's where I have a issue for a lot of people. And the reason why, both my parents passed away. My mom passed away 3 years ago, and my dad passed away last year, and they both had Alzheimer's and dementia. Thank goodness they had retirement and they had a pension. Thank goodness. But a lot of that didn't pay for the care, so I had to pay for some of the back end costs, and then some of it was through Medicare in terms of their medical supplies. And so I understand what that was like with my parents now recently. What is that going to be like for me? What's that going to be like for you?
Yeah, I worry a little bit about
in the next
Medicare
30,
in
40
20
years.
or 30 years.
I
I don't know if it'll really be there the way we see it for our parents. I think
Right.
even in my 8 years of kind of being down here in Los Angeles, I've seen it change. I've seen cuts to Medicare. I've seen reimbursements go down. And I don't know what it's going to look like in 20 years. I think, I think we need it for our elderly population, but I think it may look different. And I'm just like you. I'm rolling with the punches every year, 2 years, trying to adjust. But if I think too much about the politics and the billing, it kind of brings me down. And so I like to focus always on the surgery
and what you can control.
the charity work that I like to do, my friendships, and patience.
Yes.
And I just, I carve out a couple hours a month where I worry about billing and this and that, and then I don't worry about it.
All right. We're going to go into a subject that is personal to me, my diagnosis.
Very personal.
We're going from pros and cons of that to, thank goodness I do have health insurance and private insurance. But I really want to go cut through to this other segue. Okay. I have had issues with sciatica for the last 2 or 3 years. Okay. And it's getting worse. And so it's getting worse to where it's affecting my sleep. It's affecting my way of walking. But I know a lot has to do with I have bad knees, especially my right knee. And I think I might have to do knee replacement surgery still. So, but I wanted to speak to a spine specialist to see what I can do now. So I did an MRI last year in November, and I don't know what these words mean, doctor. If you could tell them what that basically says about my spinal vertebrae.
Yeah, MRI reports are really tough.
Okay.
Both for the provider and the patient, because it's like describing a forest and describing all the leaves and branches on a tree, you'll just get lost in all the jargon. But what is really important is the big picture, what's going on. And so it's very visual. They're trying to describe something that you can see very clearly. So I always, when we go over reports, I like to pull up the MRI images and even have a spine model out so I can show people. It makes it a lot easier. But just going into the L5S1 level, it results in bilateral foraminal stenosis. Well, that means that the nerve tunnel where these nerves are coming out, there's some pinching. Stenosis means pinching.
So this is the nerve, this yellow thing?
Yeah.
This is my nerve.
So this is a side view of the spine, and you can see the nerves come out at every level, but they also go down the canal. The spinal cord ends around here, and then below that level, we have a lot of exiting nerve roots. Below L3, you'll have the L3 nerve root. Below L4, you'll have the L4 nerve root. Below L5, you'll have the L5 nerve root, which is the nerve I think that is causing your issues. So a lot of people say, oh, I have sciatica, but if we want to really go down and properly diagnose it, we want to say, well, which nerve root is really getting pinched that's causing those symptoms of burning leg pain? It's not people, the nerves come out here and then they come together to form the sciatic nerve, comes through the sciatic notch, and that's how you get the term sciatica. But really, the symptoms are coming from individual or maybe a couple of individual nerve roots being compressed. And so that's the work we do in clinic. We get an x-ray, which shows us the arthritis and the structure of the spine really well. It's like looking at the foundation of a building.
Okay.
It tells us how tall our disc heights are. It tells us how arthritic these joints are in the back. And it also tells us if any bones are slipping out of place. If we get an x-ray standing up and we get another one with you bending over and we see a bone slip out of place, we know it's a structural problem. It's not just a nerve problem. So the x-rays are really important. And then we also look at an MRI. An MRI shows us the soft tissues better. So it'll show us the nerves, it'll show us the discs, and it'll show us nerve compression better. So we look at both studies, and then we look at the report just to make sure we didn't miss anything. And then in this report, they also talk about little disc protrusion, which can be normal, a couple millimeters. The Schmorl's node is a normal finding. And then there's some reactive edematous changes to the end plates. Well, what does that mean?
What does that mean?
What that basically means is when you start to get arthritis, just like you get it in your knee or in your spine, you start to see changes in the bones in response to the arthritis. So you'll start to get bone spurs. The end plate will start to get a little rough and ragged. The disc, that's your shock absorber, it might get a little compressed and squished. And when all of those things happen, it can start to lead to some nerve compression.
Right.
And then also we have the joints in the back that can become arthritic. And those joints can also lead to some nerve compression. So that's kind of what they're describing. But the basic gist of it is you've got this bottom level, L5S1, that's arthritic.
Okay. So I'm in the operating. You're ready to get me under, whatever. What would you, this is just fodder right now. We don't know for sure what's happening. Right now, as a patient, what would you want me to do to prepare for surgery?
So I'm conservative as a surgeon. I want my patients to be conservative for a couple of reasons. They're all nervous about spine surgery, so take your time.
Okay.
Get to know your surgeon, try to understand the surgery, try to understand the problem, and then come up with a plan A, a big checklist of all the non-surgical things you can do. Holistic or non-surgical. We'll say it's all anything but surgery.
Okay.
And what does that involve? It might involve weight loss. We always talk about weight loss, and we're very open about it because if you've got 10 or 20 pounds, it actually translates to probably 100 to 200 pounds of joint reactive forces in your spine. So a little bit of weight can make a huge difference in back pain, especially if you've got an arthritic joint that's painful. So that's the first thing we can do. 2, we like to strengthen the core and do physical therapy. So we always get people kind of going with physical therapy. If they have a component of nerve pain, where they've got shooting leg pain, sciatica, we'll put them on a medication, like a nerve medication, and that'll tend to calm things down. Other things we can try are acupuncture, massage. Sometimes patients will, if they're doing something to aggravate their symptoms, we'll just say, don't do that.
Okay.
Like if someone's like, well, every time I do deadlifts, I go, okay,
don't do
well,
that.
let's stop doing deadlifts. That's an easy one. And we'll do all of that stuff for a while.
Okay.
And then if somebody comes back after maybe a couple of months and they're like, you know what, doc, this is not going where I want. Often the conversation about surgery is reassuring. They're very afraid that it's going to be some big horrific procedure,
Yes.
but very often it's going to be something small, outpatient. And depending on what the symptoms are and what the x-rays and MRI show us, it could either be a laminectomy, which is basically a shaving procedure. If it's primarily leg pain and there's pinching of the nerve, we make a little incision here. We can drill off a little bit of bone and free up the nerve. That's probably the most common thing we do. If there's a component of instability where the bones are slipping out of place, then most likely we have to add that stability back.
Mm-hmm.
And usually that involves putting in cages and screws so the bone doesn't slip. And in other situations, if that level is really degenerative and it's bone-on-bone collapse and the patient has a predominance of back pain, then you may consider things like disc replacement or those types of interventions.
Mm-hmm.
Doing lumbar disc replacement and cervical disc replacement, these are great innovations, but not everybody's a candidate.
Mm-hmm.
You have to really be careful. We have to look at the joints for disc replacement and make sure they're not too arthritic. Otherwise, putting a disc replacement in a level that's got a ton of arthritis, I don't think gives people the best outcome.
Okay.
So we kind of want to study all this stuff.
And as a patient coming in, I've already lost about almost 40 pounds.
That's right.
I do physical therapy 3 to 4 times a week, mostly swimming because, again, the walking right now is not good for my knee, and it's painful for my knee right now. So swimming, I love swimming. I did a sound bath last night. It was awesome. A
Those are
floating
great.
sound bath at my club. It was really fun. I do a lot of stretching when I wake up in the morning because I'm just like, cause I think part of the arthritic pain I'm dealing with is just being sit for, when I'm sleeping for 7 hours. And then when I get up out of bed, I'm like, oh my God, I just feel like I'm a mummy. Like what? like cement, like sat in my bones for the overnight. And then I'm like, oh my God, I'm so sick. That's arthritis basically, right?
I mean, I think so, yeah.
Yeah.
It gives you that morning stiffness, and
Yes.
then characteristically it gets better as you get going and get moving.
Right, 100%.
And some people are genetically, for sure, a little more prone to arthritis than others.
Mm-hmm.
But I do think, with lifestyle changes, you can manage it
Yeah.
and
And
try to avoid surgery.
And I told you before we started the show, I stopped drinking coffee. I don't really drink alcohol anymore. I'm eating more non-inflammatory foods. At least I try to. I still like my popcorn and I still like, certain things, but the candy is stopped. There's a lot of things. Well, again, if I wasn't losing weight, I wouldn't be doing these things, but candy I love. I don't eat that much anymore. So, and the bread is really bad because it has a lot of inflammatory properties.
Yeah, and
Rice
it's a lot of
and
calories
potatoes,
too.
and I love white bread and wheat bread. I can't even eat that anymore.
Yeah, I almost eat no processed carbs anymore.
Wow.
And so I've had so many conversations with patients about lifestyle and cutting
Diet.
out alcohol and diet, and I started to feel like a hypocrite. So I started becoming even just gradually more and more
Yeah.
disciplined myself. And I strength train about 5 times a week. I track almost everything I eat on an app. I make sure I hit a certain level of macros, and I do that because I've started to see that if you invest that time throughout your life, it does pay off later in life. I think, that's a component of self-care. And I also think the food in our country is highly processed, and you have to be careful. It's calorie dense, but it's not nutrient dense. And so a lot of times you eat it and you're still hungry and then
Yeah.
you eat again, and it can become a bad cycle. And so intermittent fasting is one way people are able to sort of reduce their caloric intake. I think tracking is another way. Staying away from the middle of the grocery store. Just never go there.
That is so funny. The
Just-
middle of the grocery store, because the other ends is where the fruits and vegetables and meats are.
That's all you need. Fruits, vegetables, and meats.
Isn't that funny? We got the sign to already start. Can you believe it's already been 40 minutes? that we've
No,
been
we're going to have a
talking?
good time.
We're having a very good time.
I got Relax
Um,
Friday. No surgery, no clinic.
There's a couple more things we want to talk about it, but you know what? Let's cut to our sponsors, and we will be right back with a new segment.
Bon voyage!
Devin, you know me and my travels, right?
Oh, they're legendary.
And you know I always have to go first class.
First class.
So, I am actually planning another trip to Mexico in a couple weeks, and I've been wearing the same wonderful resort wear over and over again. I really want something fresh and bright and just really makes me look good on the beach. Where should I go?
I do have one suggestion for you. You can go to shopdraya.com and they have all your resort wear needs. As a matter of fact, their motto is resort wear for everywhere, which does include yachts.
Okay, well, I definitely will be on there. Is it good for the curvy girlies?
Absolutely great for the curvy girlies. It sucks you in, as they say.
Oh my goodness. Picture me on the beach and just sipping on a cocktail and having this amazing kimono just on my body and relaxing.
Don't we all need to relax? But we also need to go out in the evening, too, after we've relaxed all day at the beach. So you can go from beach to brunch, just like that.
To dinner?
Yeah, just in the same outfit. Everybody go to shopdraya.com. That's shopdraya.com.
And it's also woman owned.
It is woman owned. We love that.
Well, I'm going to go right now. And you know what? Anyone who needs a great resort wear outfit, make sure you tell them Queen ShanShan sent you at shopdraya.com. So, Dr. Verma, you're doing a wonderful outreach program in Ghana. What is your focus there, and how did you start this outreach to reach children down there?
I just always found the nicest people tended to do outreach work, and the nicest people were also pediatric surgeons. I was always drawn to them in training, and then when I got to go on this trip in Africa in 2009, it was just great. I mean, we were doing gigantic curves that you just do not see in this country because they don't have access to care,
Right.
And they have more rare diseases like tuberculosis, and in tuberculosis, if it's untreated, the whole spine collapses.
Really?
And then you literally have to like do a large surgery and rebend the spine. But the outcomes are incredible in experienced hands, and you can completely change a kid's life. And it's heartbreaking a little bit that these kids have this, and it could kill them, or
Yeah.
it gets so severe it affect their ability to breathe. And so I had the very fortunate experience of going out there, and you expect these kids to be these impoverished, sad kids. They're just running around, happy, and it
So
makes
humble.
you so happy as a surgeon. I think deep down inside, it just gives you a lot of ambition and motivation to be a good doctor.
How many doctors go with you?
Well, the first trip I went on in 2009, it must have been like 6, 7 surgeons. They were doing like 20 surgeries or more. And then
For each trip?
yeah, and they
Okay.
would like literally do like 3 or 4 or 5 a day
Wow.
with like a team of surgeons. We used to call it the frenzy back then because it was a little chaotic. And now I think we try to do a little bit less because I want the experience to be awesome.
Okay.
I want every surgeon to go to be like, God, that was amazing. I want to keep going back. I want to keep fundraising. And I also want, the volunteers and people to go to have a great experience.
Of course.
We're a little bit less focused on volume. There's something like 4,000 kids waiting for surgery in Ghana. I mean, we can't even.
That's just one country out of the whole continent.
Well, truthfully, they find these kids all over Africa. They have a
Okay.
whole network of people that they've somehow tracked these kids down. And it's a whole thing in Africa because they have to find these kids. They have no infrastructure, right? So they bring them in, they house them, they feed them, they put them in traction because the curves are too severe to operate on them
Wow.
right away. And they educate them. So they have a school for the kids.
Good.
And then we do the surgery, they rehab them, make sure they heal their wound. There's no issues, and then they send them back. So it becomes like this whole thing.
Do you continue having a similar relationship with your patients and say, hey, this is what happened to John. We worked on John 5 years ago. John is doing good. Like, do you get
Yeah.
some sort of progress reports?
Yeah, well, what's really nice about the hospital in Africa, it's the Focus Hospital in Accra, Ghana, and I've been going there for about 15 years on and off. They're so meticulous in the way they collect and organize their data.
That's awesome.
And so we published a lot of research papers saying, even though we're in Africa, this is not the wild, wild west. We're doing really high quality surgery. We can present and our outcomes and
Mhm.
publish our data, and nobody has data like this,
Mhm.
So I think it's got an academic value. Plus, it's charitable work.
Yeah.
Plus, it has value for the surgeon, I think, emotionally. And So anyway, we track these kids, and then the surgeons that are there, every surgery is usually done with 2 surgeons, and a Ghanaian surgeon, and then you. And I think that's part of the fun of it too, is operating with another surgeon, another country. They have like
Yeah,
different culture, different language,
absolutely.
different techniques. It just ends up becoming like a very rich, cool
I think
experience.
that's wonderful.
They were residents when I was a resident. Now I'm going back 10 years in practice. They're like, 10 years in practice. And it's a really wonderful friendship, and I'm really grateful for it. And now I, basically bug my friends in Los Angeles to help me raise money and see if they want to go with me.
So what's the name of the foundation that we can?
It's the Focus Hospital, FOCOS Hospital in Accra, Ghana. And if you're interested in funding or supporting this trip in some way, you can basically email me. We'll give you my email. You can call our office, and we'll get you the information. You can donate the money directly to Africa.
That'd be wonderful.
So the way it's set up right now, we don't have our own nonprofit or anything. Just give the money to Africa. When we raise a certain amount of money, we'll go out there, we'll fly out and do the surgeries.
Do you need someone to do your 501c?
Probably.
Because I can refer you to my amazing CPA.
Yeah. I mean, I've got maybe too many different projects.
Sounds like you got a lot going on. Hey, this is a little travel segment. So again, I want to say thank you for doing that for the African community. And you obviously want to grow. Are you trying to do this once a year, twice a year when you go to
Ideally
Ghana?
once a year,
Okay.
maybe even twice a year. I don't know that I could always go on every trip, but my goal is to build a group of surgeons that are like-minded. I have a few of us, that are in the area, and maybe pick surgeons that have the ability to fundraise and raise money.
Yes, absolutely.
Part of my mission doing these kinds of things is to do that.
Yep.
And
Awareness.
and then it's about $100,000 per trip, and that funds about 10 surgeries.
Okay.
And
That's
the whole
awesome.
thing, the hospital stay, the education.
Where are you staying? Are you staying in a
Um,
family's home, or you're in a hotel?
No, they have a little place. When we first used to go, they would have like the house next to Dr. Boachi's house. It was a bunch of bunk beds and stuff like that.
Okay.
And it was great when you're like a resident or a med student. But now as attendings, I think, it's hard for me to recruit my surgeon friends out there without at least a hotel room. So
I
we stay in
can
a hotel
imagine,
room,
yeah.
comfortable bed.
Comfortable with air conditioning.
The last trip we did in 2022, we stayed at a place called the All Seasons, which is not the Four Seasons. It's the All Season. And it was just like the running joke. And the mattress was uncomfortable. The air conditioning didn't work. The shower wasn't hot. So now, I mean, truthfully, we all pay for it ourselves. A little bit of comfort after a long day of surgery.
Of course.
I do
And
really
that's a long
value
flight.
sleep and exercise.
That's a long flight. That's one place I haven't been. I've been to, in Africa, I've been to Israel, I've been to Egypt, I've been to Morocco. I have not been to Ghana, and I know that's becoming a really big tourist attraction too.
Yeah,
Accra.
I've heard that.
Yeah, especially around December, there's a lot of celebrities and influencers that go around December. It's right before Christmas, and concerts and festivals are happening at that time. So I want to get on the Ghana train and see what it's like down there.
We need you. You can come with us.
I
You
would
can
love to come.
volunteer.
Oh my God,
Help
can
me
you imagine meeting all
fundraise.
those children and meeting all the parents? And I know the parents are coming to you with such gratitude,
Oh, it's
helping their children.
They're not even able to express it, but you can just
Right.
feel it. And I think
I
that's
can
the best
imagine
part.
just the tears and the whatever they do, because this is unfortunately it's an impoverished some of the kids that are coming from an impoverished part of Africa, and they probably never dreamt of being able to be helped in that situation.
Absolutely.
Because they didn't have the resources. So thank you. You have a special place with God because of what you're doing. I'm a big believer in
blessed.
karma. I'm a big believer in
blessed.
karma.
I had some bumps along the way trying to get into residency, get into fellowship, and you're not always sure it's going to work out. You're going to
Right.
make it where you want to go, And I think, yeah, just me always having a focus on like, this is the type of work I really care about has helped me. And then it's translated in my practice too. I mean, I'm the same, I think, physician at home.
You're very low key, chill. What I've noticed about you, that was part of before we ran out of time on that first segment.
You tell my wife that too.
Oh, okay. Well, how did you meet your wife, real quick?
First day of residency.
Oh,
First
she was a
week.
doctor?
Yeah, she's a physician too. She's a dermatologist in
Oh.
Long Beach.
She's a dermatologist in Long Beach?
Katie Osley, yeah.
Oh, my goodness.
Yeah.
Okay. Oh, dang
She's
it,
great.
Simeon, making us wrap up again. Real quick.
Yeah.
Real quick. Well, I'm sure your wife is lovely. Where do you and your wife like to travel for vacation?
I like to go to corners of the world, that are underserved. I mean, we went to Bali last year.
I was in Bali last year. Loved it.
Bali, but we have
Loved
kids. We can only go for a week, but I
Mm.
was just like dying to go back. We had
It's
our 10-year
wonderful.
anniversary 2 weeks ago, so we went to Thailand. And then, I'm going to go to Accra. And then I went to India this year. And then I'm sort of telling myself, you better slow down with the travel. So maybe
Why?
nothing.
Why do you need to slow down with the travel?
It's just chaos, flying to the other part of the world, flying back, jet lag. I've got
Yes, jet
practice. I
lag.
got kids. And so I think my goal is to maybe do 2-week trips around the Christmas to January time
Mhm.
with the kids. That's a really good time.
How old are-
Practice is always slow.
How are the kiddos?
They're 7 and 4. It's
Okay.
hard to, you can't take a kid to Bali that's 4 years
That's
old.
a long flight. It's a long flight for a 4-year-old to be sitting still, dude.
So then we're always like, do we leave them? I don't really want to leave them.
Yeah.
So that's the way it is. But my wife is amazing. Big supporter. I was talking to her about Africa when we met. And the interesting thing is when we met, obviously I thought she was attractive. And we met the first week of residency. She immediately dropped the I have a boyfriend bomb. I was like, oh, fine with me. No big deal. But she mentioned to me that she didn't get into dermatology. And, being a little bit of the straight shooter I am, I was like, well, don't take no for an answer. You can get in. And I had her kind of like talk to my friend, and then she like reapplied, and then she got in. And she's a phenomenal doctor.
Mhm.
You just got to be able to take the bumps in the road
Right.
if you're going to do this. They're
Right.
not every door is going to open up right away for you. And my entire office is pre-PA and pre-med students and observers. So it's got that youthful energy, which I think you appreciate when you call. I like that too. I
Mhm.
feed off of it. But I'm basically their coach. I'm like, you got to keep going. You got to apply. You got to check that box. Just hit submit.
And you encouraged
apply
your wife now, but you didn't know that was going to be your wife at the time, and she liked that.
I
She
think
liked
so.
that.
We didn't get together until about a year later, but
I'm sure it
we
stuck with her.
joke about it,
Yeah.
and, what kind of person says that?
Well, look what's happened now.
Yeah.
We're going to be right back. You're so amazing. Thank you for being my show.
My pleasure.
We'll be right back.
Dag nabbit. Shannon, I just opened my insurance bill, and do you know what? That it went up 60% from last month.
I can hear it and I understand it.
Well, this kid, he rear-ended us as we were coming out of the driveway, and that's our fault, evidently. 60% and 40% his.
You know what, Devin? It's been happening a lot these last 2 years, and insurance is out of control. But you know where you can go?
Where?
SD Langhorne Insurance Services, a.k.a. ShanShan, and they will shop for you. They actually will answer your call, too. So why don't you go on their website, ShanShan.com, look at the wonderful services they offer. They offer auto insurance, renter's insurance, life insurance, disability, business insurance, health insurance as well, and they will shop for you.
I bet they will. They sound great.
Contact them today, look at their website, ShanShan.com, and make sure you tell them Queen ShanShan sent you. So there's something I definitely wanted to talk about because you and I, you're 44 years old. I'm
Yes, ma'am.
53. So I'm Gen X. You're considered a millennial?
I have no idea.
How old are you?
I'm something. I'm 44.
Simeon, how old are you? So millennial for sure. And, back in the day, we were used to going to the doctor's offices, sitting down with a doctor and having a conversation, not just being there for 5 minutes and giving us a diagnosis. What I appreciate with you again, literally this is the first meeting I had with you. He comes in, he's in his scrubs. I'm waiting in, and he's like, "Hey, Shannon, how you doing?" I'm like, "Hey, come on in." So we go into one of the executive offices, and there's no, when you go to doctor's offices, you see the skeletons and you see the swabs and everything. It's like you go into the doctor's office. Like I felt like I was just going to a regular business meeting with the doctor. What I liked about you and what was impressive about your behavior, your attitude, is that you're sitting like this to me. You're sitting on the same level. And a lot of doctors, in my opinion, just don't have that bedside manner anymore, to where it's a number. 1, 2, let's see how many patients we can see a day. We got to see how many patients a day. Oh, we got to do the insurance. Like you said, it's a pain in the butt. Oh, we got to do it. What happened to the bedside manner that you and I were raised with, where we literally were able to sit with a doctor for half an hour? The doctor would hold our hands, look in our eyes, and tell us what's going on. What can we do?
Insurance.
That part. I knew he was going to say that.
Yeah, they
That
want
part.
us to run our practices like a factory. Everybody wants their doctor to, take their insurance, and then the insurance doesn't pay us. So a lot of doctors try to make it up with volume. They accept every insurance. They do as much as they can. And I did that for a couple of years on my own. And I moved away from it, and now we take the approach of we're going to spend our time with
Good
patients
for
in clinic.
you.
And we've had to make a lot of adjustments on the billing side, like dealing with all the billing. I was like, I'm not doing this anymore. I outsourced it
You
all.
weren't doing the billing, were you?
Well, I had someone in my office helping me, and she was a good biller. But now I have I outsource it all.
Good.
And I think it's better. And I just focus on being a doctor and a patient.
Yes.
And then I also hire more staff, I think, than average. And they're all staff that like to see patients. And so in the Marina clinic, it's usually just me and Calvin. And it's a little bit of a slower pace. But sometimes in Los Alamitos, it can get a little busy, depending on how, because we never say no. If someone wants to come in,
You're always accepting
overbook. Yeah.
patients?
We'll
Okay.
always say yes, almost always, to get you in. And so, but we'll have Calvin and Lily and me seeing patients. And when it's like the deeper conversation about surgery and there's more questions, I'm doing more of it. But it's a kind of a team approach. And so that's how we're able to spend, if I need to spend an hour with somebody
That's
before
wonderful.
surgery, I can. And a lot of times we'll bring people back 2 or 3 times because they're not sure. And it's a lot to
That's
process.
what's
You're not
happening
going
to
to
me.
make the decision all in one setting.
No.
Just
No.
hear it all, come back. And one of the tough things is we don't really generate any revenue really in clinic as surgeons. Insurance companies
You mean the visit?
they're not paying us to sit down for an hour. So we have to make it up in other ways. And so our approach is just, when someone needs us, we try to be there for them. And then whether or not they go to surgery or not, it doesn't matter. They're going to have a great experience. They're going to tell their friends and family, and other people will come in. But we want to educate everybody about what's going on in their spine. Everyone gets good imaging. Everyone gets a diagnosis. Everyone has a good plan A and a plan B about what they're going to do.
Mm-hmm.
And that's always been my approach. Almost every surgical patient has my cell phone number. I've almost always practiced that way. And that's what I want. I don't care what the insurance companies want. I want to practice medicine in what I think is the ideal way, the way the patients want, what the doctors want. And that's what I've always pushed for. And I don't know. We're trying. We're doing it.
I think that's very respectful, and because again, as a patient, and you are a patient too when you're sick and not feeling well, you have to go to a doctor, right? So we want to be listened to. I mean, I'm an insurance broker, so I'm part of that drama that you're dealing with. I'm not the adjuster, and I'm not the biller, and I'm not the person that approves the insurance policy or ensures the procedure, but I'm the one who sells it. And I'm selling all kinds of the Blue Crosses and the Humanas and the Kaisers, and I hear the nightmares that my clients go through when it comes to people being denied or wasn't paid. And then I hear the doctor's side too, the provider's side, and it's very disheartening to know that we are not being treated as beings, or being treated as numbers, because we are going through physical health issues that makes us depressed and makes us not want to move forward in our lives. And the last thing we want to do is argue on the phone with a freaking insurance claim adjuster that they denied our medicine or denied our care when we definitely need it. We want to be healthy. We want to be lively. We want to thrive. And so, unfortunately, it's expensive.
Yeah.
And this is why we need insurance. I wish we had universal health care, like other countries do, but we don't. So I just it's sucky that I hear how patients are treated by doctors, and it does suck how patients are treated by doctors are treated by patients. It's a two-way street.
Yeah.
So it's a very difficult.
Yeah, I think you just got to strike a balance. And
Well, I honor people like you, and I really was very impressed. That one visit, I'm already impressed.
I love it. Thank you. I appreciate that.
And I thank you.
We try to do that for everybody. I don't know that we always succeed, but that 99%, we want to hit that. We want 99% of people to come to be just thrilled with their visit. And then we want our surgical outcomes to be at that, same percentage. And then realistic, conversations. If somebody comes in with something really complex, the complication profile is going to be different. It's going to be a riskier surgery, and we kind of get into it with certain patients about what could go right, what could go wrong. If there's something very severely pinching on the spinal cord and there's a bruise on the spinal cord, it's very different than I've got one bad level in my spine. I just need to like fuse that one level. And so, that's part of the kind of the education of what's going on. And then we do family meetings too. Sometimes we'll kind of tell people, oh, this is, it's going to be a surgery.
Wow, it's going to be serious.
Yeah, and they come back
surgery.
Again, because you really can't have surgery without your family members buying in.
No,
to
you'll
it.
be meeting my brother. So my
Okay.
brother's always, it's just me and my brother now. My mom and dad were the ones who would always come and listen to the consultations with me, from me and my brother. Now it's just me and my brother.
Yeah.
Yeah. So he'll definitely be involved. Anyways, we're going to close this segment and then conclude this amazing podcast.
Awesome. Sounds good.
We'll be right back. So, as you guys know, this is June. We're taping this June. Today's June 20th. This month has been very active. So, we had Pride. So, I have my rainbow colors on, recognizing Pride. Happy Pride, everyone. And then we had Juneteenth yesterday. And I was able to go to Leimert Park and, have a little party and eat and hang out with the community. So, June has a lot of great opportunities. So, make sure you guys get out there this summer. Don't sit on a bump on a log. Make sure you get out somewhere, go to the beach, have some fun. There's a lot of activities. Yeah, the world's crazy right now. But you know what? What did the doctor say? We can't control everything, right? You can only control what you can do in your life. So what you can do to control your life is go to the library, go get some sunshine, get some exercise, spend time with your friends and families, because life is always going to be there. Tomorrow is always going to be another day. Okay? With that being said, doctor, I want to say thank you so much for being on the show.
My pleasure.
I literally asked him last week and he said, yeah, or no, less than 2 weeks ago. Yeah, sure, I'll be on the show. I'm like, yes, absolutely wonderful. So
I love this.
I appreciate it. Thank you so much. How can people contact you and learn about you and see who Dr. Verma is?
Well, I love that. So we have obviously our office phone number, 562-732-4578. Again, it's 562-732-4578. The practice name is Advanced Spine Care. It's a practice I built. And my goal is to maybe grow it a little bit, Advanced Spine Care. And you can follow us on Instagram, which is asc.md. And if you can remember how to say my name and spell it, I have my own Instagram, which is Kushagra Verma MD. And then we even have our own very amateur Spotify podcast that we've started. It's mainly for education. And my goal with that podcast is to bring surgeons together so surgeons can share different things that they're doing in their practices and openly discuss it. But I also want it to be educational for patients. So I think in a couple of weeks, we're bringing on a physical therapist. And I'm going to go down the rabbit hole with her, even stuff I don't know. I mean, I'm always like, oh, talk to your therapist about it. I don't know.
Yeah.
I want to ask, what are the exercises? What have you seen worked? So that way it'll be valuable, hopefully, for patients. It'll be valuable for other surgeons. It's something creative that our practice can do, just create content.
Absolutely.
But yeah, you can come see me, and we accept all PPO insurances. And yeah, it'd be my honor.
Well, thank you again. And as you guys know, you can reach me. My email address is abroadproductions@gmail.com. My social media will be listed in the credits as well. And we're always looking for new guests and looking for new sponsors. So please email me if you'd like to be on the show. We want to talk about it, see if you're a good fit. And if you want to be a sponsor, absolutely, I can send you our media kit. In the meantime, we're going to get this show going. And as always, thank you for listening to Abroad.